Hi everybody, today I wanted to talk about dissociation. In some of my other videos you may have heard me talk about when patients dissociate. So what is that and what do we do about it, and how might I be able to help a patient who's dissociating in a session? So dissociation is to disassociate. We split in certain conditions. Like borderline personality disorder, patients will often split. But this splitting is something that actually probably many of us do to a greater or lesser extent. Think about a time perhaps when you've found something too difficult to process emotionally, and we mentally distract ourselves. It's what I often call the metaphorical earmuffs, you know, like la 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 la. We don't want to hear that, and we don't want to actually look at something ourselves that's painful because we can't manage it. And once again, this is our nervous system not being able to cope. Now, in terms of body, and as a body therapist and a somatic therapist working with pain, as I've mentioned before, we feel and experience our emotions within our body. So if we're feeling tension, we hold our tension, whether that be in our gut or our stomach or our lower digestive tract, or whether it be around the chest. Then if we hold that tension there for a short period of time and we feel heartache or we feel some tension, but we're able to go through that and regulate that, then that's no problem. We all experience that. The problem comes when that's stuck there and we don't know how to regulate that in our nervous system. We don't know how to cope with it. Then we split from it because we disconnect from it because we can't cope. Now, in terms of our body, if we are not listening to our body and we're not aware of what's sometimes called interoception, our internal sense of our body, you know, we close our eyes and we know that we have a left arm. We never really think about that, but we do have an awareness all the time of our bodies. And the more aware we become, the more we are able to listen to the signals that our body is telling us. If we can't regulate that, then we split from that. And it's amazing how many people somehow are not in their bodies. And now sometimes when we're in a session, if they've dissociated from that painful area, because perhaps it's got an emotion or a trauma event associated with it, or that their trauma in earlier years has meant that they haven't learned how to deal with difficult matters within their body and nervous system, then they will dissociate from it. And if we're able to gently teach people skills through manual skills, various techniques that we can work with, including breathing and awareness, we can go back into the body to reassociate and reconnect with our bodies so that we're able to heal, because we're not splitting away from it. Right back to, as we said earlier, if we have a difficult emotion, we might feel some pain, we cry, and then it's gone and it's done. So we can process that. In the psychotherapy world, we talk a lot about processing information. Sometimes there is, of course, a necessity to make connections between what's going on in our thoughts, in our cerebral level, and what's going on in the body. And in terms of somatic work, this is sometimes where people who have not been able to fully resolve something through maybe talking therapy of some description. I'm not criticizing talking therapy, it's exceptionally good. But sometimes we need to come at things from a body point of view as well. So dissociation is when we would split away from painful and difficult sensations in our body, which might cause that part of the body to remain in chronic tension, which might give pain, back pain, neck pain, or pain anywhere, or even ill health, breathing problems, digestive problems of some kind, IBS, indigestion, etc., etc. And helping people to reassociate with those body parts and to heal them helps us to give them long-term, long-lasting relief from chronic, ongoing pain. So, as some people say, you've got to feel it to heal it. And I believe that's true. Thank you for listening.